Good morning. I'm Dr. Velasquez, Health Officer for Spokane County, and today I'm joined by Mia Parker, who is our Fatality Review and Prevention Coordinator. You've seen Mia before, and today we're going to talk about a topic that is very, very important, particularly for anyone that has, knows, or is aware of a child, neonatal or an infant, which is safe sleep. And you're going, okay, sleep, we all sleep. But remember that neonates and infants spend a lot of time sleeping, and making sure that they're safe while they do that is very, very important. So tell us a little bit about why is it that we should be aware of safe environments for children to sleep.
Yeah, that's a really good question. And unsafe sleep environments are a leading cause of death for infants under 1 year of age in our community in Spokane County and across the United States. So that's really why we focus on this topic. We also know that we can prevent these deaths and keep babies safe.
Right. Well, I'm glad you mentioned that because anything we can prevent that could lead to such a terrible outcome, which is infant death, something that we should probably look at. So what is the safest way if I have a baby, or I'm going to have a baby, or I'm related to a baby? What would be the best way for a baby to sleep? What do we have to know?
The safest way for a baby to sleep is in the same room as their parent or caregiver,
Okay.
but not the same bed as their parent or caregiver or the same surface as their parent or caregiver, whether that is a bed, a couch, or an armchair, or any other type of environment like that. You want them to be in their own space. And then you also want them to be on a firm, flat, level surface.
Okay.
The safest option is a crib, bassinet, pack and play, or cradle board.
Okay.
These are specifically designed for infant sleep and meet federal safety standards to help keep babies safe while they're sleeping. But if folks don't have access to those safest options for infants to sleep in, an alternative firm, flat, level surface can be used, like a laundry basket, a dresser drawer, a box with the top cut off. You just want baby to be on a firm, flat, level surface. And ultimately, you do want to work to get them access to those safest options, but I think it's important to be aware of those alternative options as well. And then we also want to think about dressing baby for sleep and prevent anything that could suffocate them, like loose blankets or clothing that's too big, and avoid overheating. Overheating increases the risk of sleep-related infant death, including SIDS. And when we're thinking about keeping babies safe during sleep, it's important to make sure that their sleep space doesn't have any pillows, blankets, toys, or other objects around them. This protects baby from suffocating on anything that is in their sleep surface. And then we always want to place baby on their back to sleep for naps and at nighttime during the whole first year of life. Once they get the developmental skills of being able to roll over and then roll back over, if you notice that they have rolled during the night, you don't need to reposition them when they're able to roll front to back on their own. But if they're not rolling front to back on their own, or if they're only rolling one way, if you notice that they have rolled over at night and they're no longer on their back, you want to reposition them and put them on their back. This protects them from suffocation and just helps keep their airway open.
So I know that we've shared a lot of information with folks, but we also want to show you what does it look like to do that. And Mia has brought with her a whole environment setup, so we can actually show you what is it that it looks like for a safe space for a baby to sleep and all the things we talk about, blankets and all these other things that, and by the way, laundry baskets are very well made nowadays, so I was noticing that not that long ago. They're very sturdy, so I never thought about it that way, but I get the point. So maybe you can show us a little bit of what we have in here?
Yeah. So over here we have a pack and play, and this is Heath, our health district baby, sleeping in here. And I want to show you things we can do to help keep Heath safer in this sleep environment. So it's not safe for baby to have any of these objects around him. These objects could cover baby's mouth and cause suffocation. Baby's mouth and nose are small, and the smallest amount of fabric can cover that mouth and nose and prevent air from going into the lungs. So you want to take any stuffed animals away, make sure that there's no bottle or other objects in the sleep space. No blankets. These can also go over baby's head and cause suffocation.
Okay.
And babies don't need pillows while they're sleeping. This is a suffocation hazard as well. And then if babies are sleeping with a pacifier at night, you just want to make sure they're not using a pacifier clip like this. This is okay to use during the day, but at night this could go around baby's neck and strangle them. So you just want to use a standard simple pacifier when baby is sleeping. So you would just remove that clip.
Well, you need an engineering degree to get that thing out. Thank you.
And that simple pacifier is fine. And then if your baby's sleep space has a mobile, you want to make sure all the toys are securely attached. A toy like this could cover baby's sleep space and cause suffocation. So always check that these are attached to the mobile. And then right now we're seeing babies on this firm, flat, level surface. They don't have objects around them. One other thing to do is just remove this hat. Babies don't need hats during sleep except in the NICU. This can cause overheating. And so this is a great safe sleep environment for a young baby. Heath is on the bassinet insert of the pack and play. The pack and play can also be used at the lower level. You only want to keep babies at this higher level before they have certain developmental skills, like being able to push up on their hands and knees, being able to roll over on their own, or when they meet the weight specification of the pack and play, that's when you know it's time to move them to the lower level.
Okay. And what about this over here?
Yeah, so I want to show everyone a little more about how keeping baby on a firm, flat, level surface while they're sleeping keeps baby safe. And Heath can come apart and show us this.
Don't try this at home.
Yeah. If we look at what's going on inside of the baby in different positions, we can see baby was just fed and their stomach is full. And so when baby is flat on their back, any fluid that is spit up or refluxed from that stomach is going to go up the esophagus, but not going to go into the trachea, into the lungs. Now, when baby is on their stomach, any fluid that is spit up is going to pool at the opening of their trachea and it can go down that tube into the lungs, making baby be at major risk of aspiration, choking on that fluid. And so that is one of the big reasons why it's safest for baby to be on their back to sleep anytime they're sleeping. And then that tube to the lungs, the trachea, this little indent here is the actual size of an infant's trachea. And we can see when the baby is flat, on a firm, flat, level surface, the trachea has a stable base to keep that airway open so they can keep getting air from their mouth and nose into their lungs. But when they're at an incline, say on something like a wedge, their head moves a little more toward their chest, and this puts an indent in that trachea. It narrows it, making it harder for baby to breathe. So babies are at risk of positional asphyxia, suffocating on their own body when they are in inclined positions. So you want to avoid wedges or inclined sleepers. You also want to avoid having babies sleep in things like a car seat. Now, it's totally natural for babies to just fall asleep in a car seat when you are transporting them between locations. It is safest when that happens to move them to their safe sleep surface as soon as possible. But if that is not feasible, like if you're going on a long road trip, you want to make sure that there's a sober, awake, alert adult who is able to check on that baby in the car seat and ensure that they are still breathing and doing well. And then every 2 hours, it's best to take baby out of their car seat so they are not in that same position.
And that will coincide sometimes with the feeding cycle of a neonate or
Yes.
infant. Interesting. So, by the way, we forgot his lungs, so we want to put those back.
Yes, that's important.
That is wonderful. So I'm glad you brought that because it actually illustrates the anatomical position, which is, when we talk about it, it's nice, but when you get a picture of it, then you know exactly what it is. And I think it will help folks be aware of position of the head when baby's sleeping. So for those of us that don't have, well, I do have grandkids, but not everybody has babies around them. What can the average community member do to promote a safe sleeping environment for children?
Yeah, it's a really great question, and it's important for all of us to be aware of safe sleep practices.
I'll put this on the floor so that people can see you again.
Safe sleep recommendations have significantly changed over time, and there's so much that influences how a baby sleeps. And there's a lot that we can do as community members, even if we don't have babies ourselves, to support the parents and caregivers of babies with being able to practice safe sleep. That can look like checking in with them about their safe sleep plan,
Right.
offering some options for things you can do to support them, like can I do some dishes while you rest and take care of yourself? Can I watch the baby while you're resting? Those things make a big difference.
Yeah, and actually you can watch a baby sleep, which is very helpful, and that will allow mom and others to take a break sometimes, which is all they need to do. First, I'm told new moms, for some reason, are always sleepy. I wonder why that is. But anyway, so Mia, I really appreciate everything, and we've set up here this play area, not sleeping area.
Yes.
It is okay for baby to play, but none of this needs to be where baby's sleeping. And in case you didn't catch the name is Heath, which is health without the L. And that was very intentional because we want to promote the best health for children, infants, and neonates. So I want to say thank you to Mia. Anything else you want to share with folks before we go?
I think something for the community to be aware of is we do have a day of awareness coming up. April 16th is PJs for Safe Sleep Day.
Okay.
So we're encouraging everyone to wear their pajamas to school, to work, to other community settings, and this is just to raise awareness of safe sleep and get people thinking about this and spark conversations. We know pajamas are associated with rest and bedtime routines, and so seeing all those pajamas is just a reminder that how and where a baby sleeps matters.
Wonderful. And what was that date again for people?
It's April 16th.
April 16th. So with that, we're going to say thank you to Mia for all of the information and the demonstration, which I think it was extremely useful. And everybody, if you have any questions, check out the Facebook Live, share with those that have children, or if you know of any babies that are coming, I'm sure it's good prep work before they get here. So with that, we're going to say thank you again to Mia. Thank you for joining us today. And we will see you again next week. Stay safe, stay well, and sleep well and safe. Thank you. Have a good day.